Good afternoon, everyone. Welcome to our webinar. A few reminders before we start. So to avoid distractions during the lecture, kindly follow these instructions. So kindly please keep your mic on mute, turn off your video camera. Then if you have questions, send to us by typing in the chat box. We will answer your questions during the Q&A session. If you're watching via Facebook Live, kindly send your questions through the comment section in the video stream. Thank you everyone and let's enjoy the knowledge sharing today. I will be now giving the time to Dr. Victoria Grace Dimacali uh, as she will be our moderator for this evening. Thank you everyone. Doctora.
Hello, good evening everyone, and welcome to this QualiMed Health Talk hosted by the Vision and Laser Center. So this webinar is actually the first in this series to focus on the eyes. So it's a very special night for us. Because March is also actually glaucoma month, tonight we will be learning about glaucoma and other common eye problems in the elderly. I'm Dr. Victoria Dimacali, a cornea and external disease specialist here at the Vision and Laser Center, and I'll be your moderator for the evening. So our next speaker is Dr. Noel Carino, my mentor in cornea and external disease, as well as a specialist in cataract and refractive surgery. He will be introducing our guest speaker for tonight. So let me give the floor to Dr. Noel. Oh, sorry. I think Dr. Lilibeth Maravilla made it. So let me give the floor to Doctora to give our opening remarks.
Hello, good evening, everyone. Yes, I'm sorry I was a bit late. I had to see a patient at the wards. So, good evening, everyone. Welcome to this first webinar to be handled by the uh, section of ophthalmology, of course, under the Department of Surgery. And for tonight, we have a very interesting topic which would actually tackle on the common eye problems in the elderly. This is a very common complaint of the elderly population. I myself, being a cardiologist, handle almost 80% of my patients are elderly. So these patients would usually complain to us of cloudy visions, of sudden eye pain, of recurring headache. Sometimes they will complain to you of irritated eyes or red teary eyes or intermittent vision loss. Oftentimes, we as internists will uh, approach it systemically. Of course, we see the eyes as a point of entry on our assessment of a more systemic disease. But most of the time, our eyes will tell us a lot of our patient's risk factors and its control. So for tonight, this discussion on the different eye problems in the elderly is a welcome to everyone, both to us doctors to learn more by the lecture of our expert ophthalmologists, and as well as to our patients, so that they can identify when they should be consulting us for such a complaint. So I want to thank in advance the section of ophthalmology, of course, with Dr. Noel Carino here and the rest of the team, and to our speaker for preparing for this evening's session. So back to you.
Thank you, Doctora, for the welcome remarks. Thank you for making it po. So next is Dr. Noel who will introduce the main speaker.
Hello, good evening, everyone. I'm here to present our speaker for tonight. And before I present our speaker, I can actually relate with Dr. Maravilla because we all deal with elderly patients. And funny thing about dealing with older patients is, syempre, they all want to have priority, no? Kasi senior sila. But however, almost all our patients are seniors. And of course, all of them have their senior discounts. No, so we are actually very happy when we deal with this age group of patients. Now, going back to our speaker, Dr. Joseph Manuel Cruz is a graduate of the UST Pre-Med and Medical degree. He is also the chief resident when he graduated, and at the same time, after which he took up Masters in Health Administration. Furthermore, he took fellowship in glaucoma at two institutions, the Ramon P. Cajal Hospital in Madrid, as well as the National University Hospital at Singapore, with the renowned Dr. Paul Chu. I would say Dr. Cruz is an ophthalmologist, but at the same time, I would say he's also a teacher in the same sentence. He served as a resident training director at the Quirino Memorial Medical Center, and also served as the chief section of cataract surgery in the same institution. He was also affiliated with the Medical City as associate chief in the section of glaucoma. Personally, I do not know Jonelle very well. We just came from the same high school, and I know we have a lot of common friends. However, what I know more about Jonelle are a lot of his graduates from Quirino were absorbed in our eye center, and I know that his products are very good. And I believe if the product is good, then certainly our mentor is also very good. So with this, I'd like to introduce Dr. Manuel Cruz on his lecture on glaucoma and the common eye problems in the elderly. Vicky, thank you. You can go ahead.
Thank you, Dr. Noel. So let's have the main talk now by Dr. Cruz.
Yes, thank you very much, Dr. Carino, for those very kind words, and Dr. Grace de Macali as well, and to our medical director of QualiMed for giving me this opportunity to share my knowledge of a topic that has been very dear to my heart. I have learned to love, respect, even at times fear it, because it is certainly a scourge of our times, primarily because it is a disease, unfortunately, that to this day really does not have any cure. And hence my love-hate relationship with this disease. Let me just share my screen. Okay, so as I mentioned, I have been practicing uh, ophthalmology for more than 2 decades now, perhaps just a little less than Dr. Carino. But I have been practicing the art of glaucoma uh, almost 25 years from now. And as I mentioned, this disease really is something that a lot of us are maybe aware, but not quite enough. Because the first thing that a lot of us, as I'm sure, would be asking is, do I have it? Meron ba tayong glaucoma? Fortunately, as what Dr. Di Macali had mentioned a while ago, this month of March, for every month of March, actually, every year, is the month of glaucoma. And the number one thing that us glaucomatologists are tasked to do actually is to create better awareness of the disease to the public. And so that's what we are trying to do for this evening. We start, of course, with what are the things that we need to do, anong kailangan nating dapat malaman. what are the things that we need to avoid, anong mga dapat iwasan, and what are the things that we can do to treat, not mind you to cure at the moment, the disease itself. So anong pwedeng gamot para dito sa sakit na ito? So what is glaucoma? Basically, it is a sickness or an illness that affects the nerve of the eye. So ito po yung ugat ng ating mata. Kung ating pong sisilipin ang likuran ng ating mata, isa sa mga bahaging makikita po natin ay itong ugat nating mga mata. Now, this is such an integral part of our vision. Why? Because primarily, this is the pathway to which our visual signals are delivered to the brain. If this is damaged, if you can see how this nerve is, this is a normal looking nerve. Ito po ang normal na itsura ng ugat ng mata. Pag sinisilip po namin ang likuran ng mata ninyo, pagka po tayo may glaucoma, kung makikita niyo yung susunod na litrato, ito po siya. Maputla po siya. So this is how an advanced glaucomatous optic nerve looks like. If we were to view this optic nerve o yung ugat po natin, ang analogy ko po rito ay para po siyang kable ng ating cable TV po. So alam naman po natin na ang buhay ng ating napapanood sa ating mga telebisyon ay nanggagaling po sa mga signals na nagmumula sa mga istasyon. Yun ho ang ating napapanood. At ito po ay nakakapunta sa ating mga tahanan sa pamamagitan ng mga kableng nakakonekta po tayo. In other words, kahit ho kayo bumili ng pinakamaganda po ninyong telebisyon, kapag ka po may sira po ang kable ng inyong TV, wala rin ho kayong mapapanood or malabo po ang inyong pinapanood. So, if we were to cut away the skull of an individual and expose the eyeball, what you see there connected to the back is the nerve. No, that's the extension of the nerve that we saw a while ago from inside the eye. So that one leads directly to the brain, and that is where the visual signals that are set are actually processed, so that you know that this is a table, this is a chair, etc. Now, this eyeball has to be maintained by a fluid po. So yung loob po ng ating mata, meron po tayong tubig diyan na ginagawa po ng ating mata bawat segundo. Ang dahilan po nitong tubig ng loob ng mata natin na ito po ay kakaiba po sa luha natin. Itong tubig ng mata sa loob ng mata natin, or what we call aqueous humor, marami po siyang dahilan kung bakit po siya ay kinakailangan. Unang-una, para po ma-maintain natin yung hugis ng ating mga mata, at nagbibigay rin po siya ng nutrisyon sa ating mga mata. At itong tubig po na to ay, tulad na banggit ko, ay tuloy-tuloy po nating ginagawa. Para sa ganun po ay yung presyon sa loob ng ating mata ay ma-maintain po natin. Para sa ganun po ay nananatili po siya sa kanyang konfigurasyon. Pagpalagay nyo na meron po tayong gulong ng kotse. Kung ang gulong ng kotse po natin ay napakababa ng pressure ng linalagay po natin, then naiiba na po ang kanyang hugis. So this fluid is very important to the eye for a number of things. However, like anything else in life, kung ano pong ating pinapasok sa isang bagay, ganun din po dapat ang lumalabas. So that this fluid will be utilized by the eye, and upon utilization, linalabas po natin siya, sinisikret po natin. Therefore, creating a balance both with the amount of fluid in the eye and the pressure that it creates within the eye. So ito po yung lumalabas sa dalawang sistema po na drainage natin. At ito pong drainage natin, which we call the trabecular meshwork drainage system, actually goes out, no? And this can actually be visualized through special lenses that we have in our clinic. So nakikita po namin yung drainage system ng ating mga mata, no? So pagka kayo po ay nasa klinika po namin. Now, maihahambing po natin ang drainage po system ng ating mata na tulad po ng gripo na pumupunta po sa ating pumapatak po sa ating lababo. Okay? So water is placed on the water basin to which our drainage system here will allow it to flow out, no? Bringing with it all the wastes that comes out from the basin. Ganun din po sa mata. Yung linalabas din po ng ating aqueous humor, meron din po mga waste materials din pong linalabas po niya. So that's how more or less the drainage system within the eye functions. Now, meron po tayong sitwasyon kung saan po tumataas po yung presyon ng mata natin sapagkat ang problema po ay yung drainage system ng ating mata. Itong presyon ng mata, kapag ka po itutumbas po natin ito sa gulong ng kotse, pag ino-overinflate naman po natin ang ating gulong ng kotse, naiiba na po talaga ang hugis ng gulong, di ba po? And that's the same thing that happens with the eye. If the pressure of the eye is so high or higher than what it should be creating to have this equilibrium or balance within it, no? Ang nangyayari po ay nag-iiba na rin po ang hugis ng isang istruktura na napaka-importante sa mata natin at yun po yung optic nerve. So yung pag-iiba ng hugis ng optic nerve is actually equivalent po ito sa damage na po ng nerve. Okay? So numinipis po siya habang po siya ay nadadamage at namumutla rin po siya. Now, there are two ways in which yung drainage system natin will not work. So the first type po ay yung open type. Now, yung anggulo ng mata natin na nabanggit ko po, na sinisilip po natin sa espesyal na lente that we have in our eye center po, no? Makikita po natin kung wala pong nakaharang po doon. In other words, there are no obstacles that is covering the drain. Similar po dito. Wala naman pong nakatakip po sa drainage, sa external drainage po ng ating lababo. However, bakit po umaapaw yung tubig natin dito? Sapagkat po, ang may problema po ay doon sa kaloob-loobin ng ating drainage. And that is basically what is the open type of glaucoma. Okay? Now, yung pangalawang uri po ng glaucoma naman ay yung tinatawag natin na narrow angle. Ito naman po, meron naman pong obstacle or nakaharang dito. At hindi po malayo na ang karaniwang hadlang po sa paglalabas po ng tubig sa ating mga mata ay yung ninyo ng ating mata or what we call the iris. Because it is the iris, which is the brown, well, for Filipinos, it's the brown iris, or for Caucasians, blue or green, that is actually in the periphery where the drainage is. At kung makipat po siya, tulad po ng ibang mga mata na makikipot po, madali po siyang maharangan po yung ating drainage system. So kung itutumbas po natin uli siya sa ating lababo po, then meron po talaga nakaharang po doon sa drain natin. Makipot po siya tuloy, no? Kumikipot po siya doon. So that's why it's very important that we evaluate the angles, whether it's open or closed, so that that type of glaucoma can be identified. And later on, we can now make certain measures depending on the type of glaucoma. So, yung closed type ng glaucoma, talaga pong ganito po ang itsura po niya. Yan, hindi na po nakakalabas po siya. Saradong-sarado na po siya. So, tulad na nabanggit ko sa inyo, na dedeforma po yung ugat ng mata. Nakikita niyo po rito, para na po siyang umuuka, no? Lumalalim na po, naiiba na po yung forma, at nagda-damage na po siya. So, kung nakikita niyo po sa upper left side picture ng ugat ng mata, at pababa po siya, nakikita po natin na paputla ng paputla ng paputla po siya. At kung titignan po natin siya at the level of the nerve itself, umuuka po siya, lumalalim po. Ibig sabihin, numinipis po siya. So, ito pong kondisyon ng glaucoma ay nakikita tulad ng sabi niya ni Dr. Maravillas sa mga pasyente natin na may mga edad na po. Although, sasabihin ko lang din po sa inyo na meron din po kaming mga glaucoma po na nakikita rin po namin sa mga bagong panganak. Ito po naman ay mga secondary na condition dahil po sa mga ating mga ina na nagkakasakit sa unang trimester ng kanilang pagkabuntis. Kadalasan po ay ito po ay napapasa dahil po ay nasa lahi po ng isang tao po ang glaucoma. Sa makatwid po dito sa atin sa Pilipinas, meron po tayong nakikita na ikatlo hanggang ikaapat pa ho nga na henerasyon na may mga pasyenteng may glaucoma. Ito po ay madalas ang sinyalis po na nagbibigay sa atin ng ideya kung may glaucoma o wala, o kung mataas ang posibilidad na may glaucoma isang pasyente ay kung masyadong mataas ng grado sa mata. Whether ang taas ng grado ay pagka-near or farsighted. Maraming mga Asyano ang napipinsala sa kondisyon na ito. Meron tayong mga pasyente na pagka naaaksidente po ay nagkakaroon po ng mga secondary type of glaucoma or di kaya yung mga ibang pasyenteng bigla yung mga naooperahan po. Minsan po sila ay nagkakaroon mga ikalawang uri ng secondary type ng glaucoma po. Marami rin po tayong mga pasyente, lalo na po yung mga may sakit po sa bato or sa kidney po na long time na nag-iinom ng steroids, no? Bukod po sa katarata na nagkakaroon po yung ating mga pasyente, nagkaka-glaucoma din po sila. Ano po ba ang nararamdaman ng ating mga pasyente? Usually, they don't notice anything. That's why it's important for you to understand that the common quotation in patients with glaucoma is that it is a thief in the night. In other words, you don't feel anything, but you're losing something. So whether it's open or in some cases closed, people don't really feel anything, the type of glaucoma. But there are those individuals na they would be going to our emergency room, complaining of severe headache, sudden blurring of vision, nauseated, nagsususuka sila pagdating sa emergency room, para po sila nagkakaroon ng bahaghari sa paligid ng kanilang ilaw na nakikita or parang nag-halo po effect. Ito po ay sinyalis po ng mataas na presyon ng mata. Ang presyon po ng mata ng normal na individual po ay mula 10 hanggang 21 millimeters of mercury po, no? Ito po ang normal pressure. Sa mga uri ng glaucoma tulad ng mga acute type, yung nakikita sa emergency room na sobrang sakit at sobrang labo ng paningin, umaabot po sa 60. So you can imagine rather, it's 6 to 3 times more than what a normal individual pressure should be. So makikita po ninyo kung gaano pong maaaring napipinsala ang ugat ng mata ng mga taong ito. So kung ito pong nakikita ng mga pasyente natin at ng normal na mga pasyente natin, ang mga pasyente naman natin na may glaucoma, makikita po natin na ang tagiliran ng kanilang mga paningin ay malabo po. So karamihan po yung mga advanced type na glaucoma, their peripheral vision goes first, and therefore some of these individuals are really prone to develop accidents kasi po hindi nila nakikita yung mga kanto at yung mga gilid po. At habang lumalala po yung glaucoma, habang namumutla po ang ugat ng ating mata, pawala po ang ating paningin. Yung kahuli-huli ang litrato po rito on the lower right-hand corner is a vision of a patient which we call tunnel vision. In other words, kahit po kayo ay may 20/20 vision po, maaaring ganito kung kasama ang inyong glaucoma, maliit na lang po nakikita ninyo sa sentro ng inyong paningin. So, to all of us, do not think that if you have 20/20 vision, that you cannot have the worst type of glaucoma. So, what are the things that we should be doing in order to assure ourselves that we have or don't have the disease? Of course, a regular checkup, especially if you have that history in your family. Okay? If there is pain in your eye that you honestly don't know what it is, then certainly that is something of concern, and you should have it checked out so that we can check the pressure of your eye and take a look at that nerve as well. So these are the number of things that we can do in the Vision Laser Eye Center. We can check your vision, of course, and do a complete eye examination. Here we have the specialized microscope to which we can view the microscopic structures of the eye. And we can also check the pressure of your eye through a procedure called tonometry. We can also take a look at your nerve, the optic nerve, through the procedure called ophthalmoscopy. And we can take a look at the angle structures, where the drainage system is 360 degrees in your eye through the procedure called gonioscopy. All of them will take just less than a minute or 2 minutes to perform. And the one that takes a while, which we request to do, is to check your field of vision, yung lawak ng paningin po ninyo. Tulad ng nabanggit ko kanina po, maaari po kayo mawala ng paningin ninyo nang wala po kayong nararamdaman po. And the only way to test this is to do a field of vision evaluation. So para titingnan po natin, excuse me, kung gaano kalawak po ang paningin ninyo na natitira po. So ito po ang instrumento namin that we use to check the pressure of the eye. We just put a drop of anesthesia and wala po kayo mararamdaman. We will be able to get how many millimeters of mercury the pressure of your eye would be. By the way, the pressure of the eye changes, no? Ito po hindi constant. It's usually highest in the morning, early morning, and goes down. It goes down a little bit towards the late afternoon. These are the special lenses that we do, which we just again just put on top of your eye. You won't feel anything at all when we perform this, and we will be able to determine whether or not you have open or closed angle types of glaucoma, if you do have glaucoma. Other types of documentation machines that we have in our center will be to take a picture of the nerve of your eye, like the picture na pinakita ko po sa inyo. These are the other machines that we have that test for the field of vision. And also we get the thickness of the front of your eye, because sometimes the thickness of the front of your eye can actually alter the actual pressure of your eye. So knowing this gives us more or less a rough estimate as to what is the true pressure of your eye. So ano po ba ang dapat nating matandaan po when it comes to glaucoma? It is the number one cause of irreversible blindness in the world today. And I'm talking 2022. So the whatever damage that you get from glaucoma, right now, medical science does not have a cure for giving it back to you. In the same token that right now, yung pong ating mga pasyente na nagkakaroon ng tinatawag na mga spinal cord injury, karamihan po sa kanila ay hindi pa rin nakakalakad. Because like the spinal cord, it affects the nerves, and ang nerves po ng katawan ng tao, tulad ng ating sariling optic nerve po, cannot regenerate. Hindi po siya tulad ng balat na kapag ka po masugatan ay bumabalik po siya. So ang aming pakay po bilang mga espesyalista sa glaucoma ay para mapreserba po natin yung natitira po ninyong vista na hindi pa po nadadamage ng inyong glaucoma. Now, paano ba natin ginagamot ang glaucoma? Even if we have no cure, we can control the disease either through medications, either through laser, at kung talagang sobrang sama na po ng kondisyon or advanced type na po siya, we do surgery po. Ito po ay panghabang buhay na sakit. So, I have been practicing glaucoma since 1996 po. And I still have the same patients. If they haven't yet passed away, they're still with me up to this day. So sila po ay nananatili po mga pasyente namin, sinusubaybayan po namin, at we are trying our best to keep whatever vision that they have left. Ang paggagamot po ay maaari rin pong panghabang buhay na po. So ang ating mission sa Glaucoma Month will be to try to detect and to treat the disease in order to avoid blindness, so that your lifestyles will at least be maintained. No? So with that po, we are kind of hoping that your families, your friends, your loved ones, if ever, need not be affected by this disease if we can detect this early and we're conscious about how this disease will affect our livelihoods. Maraming salamat po.
So thank you, Dr. Joseph, for that very, very informative talk about glaucoma. So I'm sure lahat tayo madaming natutunan from this talk tonight. Glaucoma is really an underdiagnosed eye condition. Kaya important ang screening, lalo na sa mga matatanda na never pang na-check ang mata. Kasi in my experience kasi, sometimes they attribute this blurring of vision sa pag-edad or sa cataracts, and they don't even bother to check kung may ibang condition pa pala sa mata nila. So now the floor is open for any questions for our speaker. Please feel free to type in your questions in our chat box in the Zoom app. So far, there's no questions yet. So I'll open the floor by asking the first question, Dr. Joseph. In your experience po ba, madami yung elderly patients na na-diagnose niyo with glaucoma na takot magpa-opera? Kasi I also experienced this eh. What do you say to them to encourage them to have surgery?
A lot of chair time, definitely. Marami pa rin sa ating mga kababayan really do not understand this disease. Remember, the most common things for them as far as the eyes are concerned are cataract and malabong mata dahil may grado. That's the most common layman perceptions of eye problems. No, you ask them, do you have glaucoma? What's that? So sometimes it's very important to dig deep sa history ng ating mga pasyente and try for them first to understand what it is, and if and when the situation will arise that we cannot control the disease, be it through laser, less invasive procedures, or through medications, then that's the time we have to show them a what are the chances that they will go blind permanently? No? So in terms of trying to convince people with advanced glaucoma to undergo surgery, you really have to put in a lot of chair time. Let them really understand it. If they haven't understood it since the time that you've started treating them, no, I think it's just that, no? Really getting them to get the gist of what may happen to them in the future. The beauty naman ngayon kasi is there, especially with the World Glaucoma Association, having a lot of movements to try to send out pamphlets and online paraphernalia to try to educate a lot of people. Mas madali na ngayon talaga para sa mga pasyente na na sumang-ayon sa whatever na i-recommenda namin na treatment, be it conservative or surgical.
Thank you for your answer to the question. Is there any other question from our audience?
Hi, Junel.
Or our speaker?
Hi, si Noel here. So before I go to my question, no, meron din akong konting advertisement. So you showed a lot of machines kanina, no, dun sa lecture mo, and I just want yung mga tagapakinig natin na malaman na lahat po ng mga machines na yon ay available naman po sa Qualimed, dun po sa kwarto ni Dr. Jonel Cruz, katabing-katabi lang po nun yung mga makina na pang-test po sa glaucoma at iba pong mga sakit, no? Now, ang question ko, Jonel, is yung risk factor, yung mga nakikinig sa atin ngayon, madalas kasi ako, sinasabi ko, sana wag masaktan yung mga tatamaan, sinasabi ko sa mga pasyente, if you are female, farsighted, and over 50, meron kang risk for glaucoma. So can you explain sa amin bakit yung tatlong F na yon at malamang meron pang mga iba ay delikado for glaucoma? Plus na-mention mo rin yung isa kanina, no? Yung may history ng glaucoma. Kasi usually yung tatlong F na yon kasama rin doon sa history ng glaucoma. Sige, Jonel, ikaw mag-explain.
Thank you, Noel, for that question. At marahil marami rin sa ating mga tagapakinig dito na that probably is a question in their mind as well. So, bakit yung mga far-sighted na mga tao na kadalasan babae at nasa edad 50 ay very prone to develop this type of disease? Specifically po, the angle closure type of the disease. No? For far-sighted individuals po, usually po yan, maliliit po ang kanilang mga mata. No? So very crowded po yung nabanggit ko kanina na tinatawag na anterior chamber kung saan po lumalabas po yung ating aqueous humor or yung tubig sa ating mata. It's very crowded at maaaring magkaroon ng sitwasyon kung saan po yung ninyo ng ating mata, the iris, could actually close. Especially po kasi since very dynamic po ang ating iris po. No? Kung alam po natin ang ninyo ng mata po natin, ito po ay gumagalaw, lumalaki po siya kapag makulimlim ang panahon or lumiliit po siya kapag mataas po ang araw. So pagka kumukulimlim o ang panahon or yung tinatawag natin na dark room effect, then tumataas po ang presyon ng mata kasi po yung ninyo ng mata ay nagbibigay ng hadlang po sa paglabas ng tubig sa gilid po. So yun ho ang nangyayari. Kaya ito po ay nakikita lalo na when they got the data o na ito pong mga uri ng mga pasyente na sa ganitong edad sa ganitong kasarian, nagkakaroon sila ng angle closure type ng glaucoma. Ito naman po ay naiiba doon sa mga karamihan pong mga may open type po. No? As a matter of fact, itong open type po ay mas nakikita actually sa mga Caucasians po natin, ang mga kasama sa bundo, no? There are some Filipinos who are naman nearsighted. Ito naman po yung mga malalabong mata po na kailangan ho lumapit para makakita po sa kanilang na tinitignan po. Lalo na po yung mga sobrang matataas na grado pong nearsighted po. Ang nangyayari naman po ay ang problema nila ay doon mismo sa drainage, no? Ito pong mga ito, lalong-lalo ng kinakailangan nating talagang suriin ang kanilang family history. Baka merong makalusot na ay meron pala ang kanilang lolo, hindi lang nila alam na nawalan na pala ng paningin nang hindi nila alam ang dahilan. Sumasakit na lamang. So yun ang kinakailangan natin suriin. So yan ho ang mga kailangan nating tandaan, no? Yung binabanggit sa atin ni Dr. Carino, yung mga female, 40 and farsighted individuals.
Okay, so now we have some questions from the audience. So the first question is, ano po ang percentage ng success ng surgery for glaucoma based sa experience nyo and sa statistics?
Ang success naman po ng aming mga operasyon sa glaucoma, sa buong mundo naman po, I'm happy to say, hindi naman po tayo nalalayo sa mga ibang eksperto sa buong mundo, no? Mahuhusay na po ang ating mga dalubhasa sa glaucoma, lalo na sa mga operasyon. Kung tatandaan nyo, nabanggit ni Dr. Carino, 2 beses pa ako nag-fellowship. Kasi po, yung pinuntahan kong una po ay karamihan po ng mga tao doon ay mga puti. At yung ikalawang pinuntahan ko naman po ay karaniwan naman po ay Chinese community patients po namin doon. So magkakaibang populasyon, magkakaibang uri ng reaksyon, lalo na sa mga operasyon. So maganda naman po, generally, ang kinakalabasan po ng ating mga operasyon sa glaucoma. Basta po nakukuha po natin sila na maaga. Yun lang naman po ang importante doon. Try to get them, to detect them as early as possible, because if the advanced stage is there, even if you are able to more or less control the pressure, which is basically what we can control at this point in time, the pressure of the eye. Kahit na makontrol na natin yan, ito na lang ang nakikita nila, kakakiting na lang, no? The level of the satisfaction of the patient will never be that good. No? Even if you can tell them, oh, I was able to control your pressure, but then you can only see through a small hole already. So early detection is still the mainstay of mainstay factor to determine the true success of glaucoma surgeries. No, but basically, if you detect them early and before it gets to an advanced stage, the surgery success is very, very high.
Okay. So moving on to the next question, is there a certain age or any predisposing risk factors wherein there is a recommendation for routine screening, and how often?
That's a very good question. And the answer there is most of the devices that we have, be it the visual field test that I was telling you about, and the other device that we also have in our Vision Laser Center, which is the optical coherence tomography. Yun naman po, na-detect po niya kung gaano ka numinipis or gaano kakapal pa po yung ugat ng mata. Tulad na nabanggit ko, kung nauuka na po siya o nade-deforma. So we have these devices, but currently, these devices are they're age-based age-based population. In other words, ang mga tests po na ginawa nila ay mula 18 anyos po hanggang pataas. So yung accuracy nila po is from 18 years old and above. So anyone younger than that, it may not necessarily be a good determinant of whether or not you have glaucoma, or if you do have glaucoma, if it's getting worse. So in those cases, no, we just have to do just a photo of the nerve regularly and check the pressure and just monitor them closely. But it's usually 18 years old and above. Kung pwede na sila, let's say you have a history in your family, um, let's say I have glaucoma, then there's a 50% chance my children will have glaucoma as well. So I would have my children as early as 18 years of age already undergo these tests. But if they're younger than that, at least go to the glaucoma specialist to have yourself evaluated, even though these detecting devices are only as accurate as 18 years old for those 18 years old and above.
Okay, next question. For those diagnosed with glaucoma, but with a history of corneal ulceration during earlier years, what are the treatment options?
Well, uh, as long as the corneal ulcer has been treated and it is not active, and I think Grace can actually and Noel can probably answer this better. No, as long as it's not active, then there's no reason why we could not treat the glaucoma. No, in the same manner as those without the corneal ulcers. Now, if it's active, then maybe there are certain drugs that we might not be giving, no? Especially those carbonic anhydrase inhibitors that might affect the cornea itself in terms of its clarity. So we try to avoid using those. But other than that, if the ulceration is not active, it's becoming leucomatous, then there's no reason why we cannot do glaucoma. So in terms of surgical interventions, if the ulceration is inactive but the scarring is extensive, then we might be limited with visualization, especially if we are to put as a surgical option the utilization of glaucoma drainage devices or even minimally invasive glaucoma devices. So, but other than that, in terms of medications, no, there's actually not much difference.
Yes, and the glaucoma treatment, glaucoma surgery doesn't really involve a big part of the cornea. So, it's a high chance naman that you can have a glaucoma surgery if it's not too big and not active. So, next question. Are there practical measures to prevent or delay development of glaucoma?
Well, again, as I mentioned a while ago, as long as we're able to detect them early, we could actually start treatments immediately, be it medications or laser treatment. Uh, this is the era of what we call the light study, LIGHT. We have a special laser actually that has been formulated for open angle types of glaucoma. And it has been recommended that we do this non-invasive procedure first before we start medications on patients. But then the option to continue with medications will always be there. No, so early detection is always the key.
Okay, thank you. So from our Facebook Live, there's also another question. Ako po ay may glaucoma, 10 years na halos po. May pag-asa pa po bang makakita ulit? Wala po sa lahi namin ang glaucoma.
Ang importante lamang po ay malaman natin po kung gaano kasama na po yung kondisyon na yan, no? So in other words, importante po na ma-classify natin whether your condition is mild, moderate, or advanced. And depende po kung nasaan po tayo nakalagay, doon po tayo mag-iisip kung ano po ang kinakailangan nating treatment na magawa para sa inyo. So importante lang din po na magawa natin yung classification at ito po ay magagawa natin kung dadaan po kayo sa mga glaucoma testing devices tulad ng meron namin sa Vision Laser Center para po malaman po natin yun at we could give the appropriate treatment for you.
Okay. So our last question so far is there a certain age for mandatory glaucoma screening? So earlier you mentioned po that it depends also on the family history kung meron sa lahi kasi it's a big part.
Yes, definitely. No? So as long as there is a history, ano na yun, para sa akin, outright na yun na kinakailangan ma-screen na sila for glaucoma.
Okay. So if there's no other questions coming, I'll leave the floor open for 1 more minute or so. From our Facebook Live po ba, may questions pa?
Wala na po.
Okay. So I think we can close the night already. So let me give the floor to Attorney Nirmala Vanguardia, our Chief Operating Officer. We'll have our certificate of appreciation first. So thank you for these certificates for me and Dr. Joseph. So we are presenting this certificate to Dr. Joseph Manuel M. Cruz for his participation and valuable contribution. Sorry, may pop-up lang po. For his expertise and valuable role as speaker during the webinar entitled Glaucoma and Other Common Eye Problems in the Elderly, given this 28th day of February 2022 via Zoom virtual event. We'll just send this to Dr. Cruz later. Okay, so for our closing remarks, let me give the floor to Attorney Nirmala Vanguardia, our Chief Operating Officer at Qualimed Hospital, Santa Rosa.
Thank you, Dr. Dimacali. First and foremost, I'd like to greet everyone. Have a pleasant evening. Of course, I'd like to thank our expert speaker for tonight, Dr. Janelle Cruz, for taking the time to join us in our advocacy on health education by sharing his knowledge to our community and making it all very easy for us, no, with all the illustration and even translating it to the local language, no, Tagalog. So I'd also like to thank Dr. Dimacali, no, for facilitating, and also to Dr. Noel Carino for leading this activity and helping us organize this. My appreciation also goes to all our doctors present here tonight from the different specialties for taking time to understand and learn, even if it is not within their own specialty, so that they will be able to further provide holistic care to all our patients. Thank you to our nursing and VLC team led by Mr. Mike Alamay. Thank you as well to all our patients and our partners who are present here tonight. I hope that through this webinar, we are able to encourage you more to take full control of your health, especially on the early detection of glaucoma and other common elderly illness, as discussed by Dr. Cruz tonight. For all your eye care needs or your family's needs, in case you are experiencing any eye discomfort or any condition, we are proud to say that in Qualimed Hospital Santa Rosa, we have a full range of eye specialists and subspecialists. And they are fully supported, no, with the right technology. In fact, our Vision and Laser Center services actually offers all these diagnostic procedures. No, we have the fundus photography, the FA, all are posted on the screen. No, we do biometry, perimetry. Sorry, I would have wanted no to explain para saan to, but just feel free, no, to visit us in Qualimed Santa Rosa for our ophthalmologist clinic schedule and inquiries for our Vision and Laser Center. The number is posted on the screen, so feel free in case you have a hard time accessing through our phone lines. We are also accessible through our Facebook page and our messenger. Thank you very much, everyone, and hope all of us will have a restful evening. Thank you. Have a great day and great evening.